Hi, my name is Dr. Natalie Muth, and today I'm going to talk about screen time and health, what parents, what you need to know. If you feel like screens have taken over your life, you are not alone. The average teen now spends 7 to 9 hours per day on screens, and that's not counting schoolwork. And the impact on our kids' health in many ways, including weight, is real and well documented. But there's good news. Understanding how screen time affects health gives us the power to make meaningful changes. So let's break this down. We'll break down the research and then what you can actually do about it. And we're going to dive a little bit deep into this so that you really have some tools that you can use tonight at home. So let's go way back. In 2008, there was this study that was groundbreaking that was published that showed when kids were randomly assigned to have less screen time versus a normal amount of screen time, the kids who had less screen time had decreased BMI compared to the kids who didn't. So they had less weight compared to the kids who didn't, despite everything else. This was the first study that really showed that screen time in itself can impact weight, but also reducing screen time can help kids get to a healthier weight. So let's talk about that screen time and how it might be contributing to weight gain and what we can do instead. So number one, screen time replaces active play time. Every hour a child spends on the screen in a day is an hour that they aren't spending running around outside, playing sports, riding their bike, dancing, building forts, playing tag, going for walks with you or with their friends. All these activities don't just burn calories, they also help to build strength and muscles, improve mood, help with focus and learning, teach social skills. We want kids to be active and move. Secondly, mindless eating while watching. Think about what happens while you're watching TV or scrolling your phone. You're probably not paying too much attention to what you're eating, if you're eating something, whether you're actually hungry or not, how much you ate, when you're getting full. Kids are the same. Eating in front of screens leads to more, sometimes a lot more consumption of food than they would otherwise eat. Plus, kids kind of learn that screens and snacks become paired together. So eventually, just turning on the TV or getting on their tablet or phone can trigger a desire to eat, whether hungry or not. Third, screens mess with sleep. Screen time, especially before bed, disrupts sleep in 3 ways at least. The blue light from the screens tell the brain it's daytime, suppressing the sleep hormone melatonin that helps us to fall asleep. In addition, the content keeps the kids' brains activated when they really should be winding down. Just one more episode or endless scrolling delays bedtime, makes it harder to fall asleep, and gives them less sleep. Poor sleep disrupts hunger hormones, and when kids don't sleep enough, they feel hungrier during the day, they crave high-calorie foods, and they have less energy for physical activity. Fourth, constant food advertising. Your child sees hundreds of food ads every day on screens, and these ads overwhelmingly promote sugary foods, sugary cereals and snacks, fast foods, candies, and processed snacky junk foods, sugar-sweetened drinks. And this constant exposure shapes what foods kids want. It shapes what they ask you to buy, and it makes unhealthy eating seem normal. This creates a powerful pester power directed at you, and it can be quite annoying, but in addition, this marketing is so sophisticated, targeted, and effective at getting kids to want junk food, they just eat more. And then fifth, just overall less movement overall. Beyond replacing certain physical activities, more screen time means more sitting throughout the day, less spontaneous movement, fidgeting, more sedentary transportation, like riding in the car versus walking or biking. And all of this adds up to less energy burned throughout the day. So let's talk about what the guidelines suggest, and then maybe some ways to try to take small steps to get closer to them. So for kids under 18 months, recommended to try to really minimize or have no screen time except for video chatting with family. Kids under 18 months of age don't get any benefits from screen time, and it can delay their language development and social development. For 18 to 24 months, if introducing screens, try only high quality programs, watch together what they're seeing, and make it very limited. For kids 2 to 5, aim for a max of about an hour of quality programs, and if possible, when possible, watching together. And generally, this is for all ages really, try not to have screens during meal times, within an hour of bed, or in the bedrooms. Okay, so how about school age, 6 to 18? Try to aim for 1 to 2 hours of entertainment screen daily. Homework is separate. I know this is aspirational much of the time, but it's a general guidance. And really try to make sure that screens aren't crowding out or replacing quality sleep, physical activity, family time, homework and reading. All of these things should come first and then the screen later. So speaking of physical activity, how much should kids be moving? Well, you know, a lot of screen time often makes it so there's less physical activity time. So try to prioritize the activity. So for babies, try to get tummy time from birth, working up to 30 to 60 minutes per day. Lots of floor-based play and minimizing time spent contained if not needed, like in strollers and in swings and things like that, as much as possible. For preschoolers, aiming for 180 minutes or 3 hours total a day of varied activity. It's about 15 minutes per 1 hour. Just unstructured play and running around and moving around is really, really important. And then as we get into school-age kids and teens, so 6 to 18 years, the goal is to try to get 60 minutes a day of moderate to vigorous activity. Variety is key. Things that they enjoy doing, really important. Sports, swimming, biking, martial arts, whatever it is that will help them move. And then really trying to also get strength training in. You can start at young ages and trying to get it at least 3 times a week to get resistance training and strength training to keep the muscles and bones strong. Now, everyone who's a parent knows that screen time can be a huge challenge. So how do you get through screen time without having battles? Well, first of all, think about having screen-free zones. So these are places that are screen-free for everyone, including parents. Bedrooms, try not to have phones, TVs, tablets overnight. Dining table, meals screen-free. So trying not to have the screen allowed at meal times, even trying to have no screen during snack times as best you can. And set clear times when screens are off. During meal times, 1 hour before bedtime, during family time, during homework, unless actually needed, of course, for an assignment or something. But we want to replace, not just restrict. So we want to have other things that take up the time to crowd out all that screen time. So appealing alternatives like outdoor play and sports or board games and puzzles, reading together, arts, crafts, building projects, music and dance, cooking together, in-person time with friends. There's all kinds of things that can help crowd out the screen time. And finally, model the behavior that you want to see. So this is huge and hard, but model the habits that you want your kids to do, and it will be enormously impactful. So trying to minimize checking your phone constantly during conversations, or watching TV or being on the phone instead of playing with the kids, or taking the phone to bed. Instead, try putting your phone away during family time. Reading books instead of scrolling before bed, being fully present during conversations, showing that life exists beyond screens. It's tough. It can be hard. So we want to do what works and what we can fit into our day. Importantly, I don't want to forget to mention, it's important to do privacy and controls on the screen time for the kids. So really having restrictions that limit their access and exposure to all kinds of manipulative things that they can get exposed to online. So really create a family media plan. The American Academy of Pediatrics recommends this, and I find it to be very helpful. So there's a resource that we'll include that you can go to, and you create a plan together that you all agree to try to help make it a healthy screen zone at your house. So you can customize a plan, because let's be real, all of these things are not going to be realistic or possible all at once. So you want to choose the things that feel doable, that you can start with and take small steps. And you want to get the kids on board and other family members on board and doing it together, because when you do it together, people are more likely to want to go along with it and to really try their best, so that you're having a team approach to making these positive changes rather than having a battle. So check out that family media plan that's provided by the AAP, and choose maybe just one small step that you might take to help make your family's life a little bit healthier and happier by crowding out some of that screen time and replacing it with healthy activities. Thanks for checking us out. Again, my name is Dr. Natalie Muth, and I'm co-founder and CEO of Natalie Muth Health.